When we talk about keeping our kids safe, we're talking about preventing them from getting involved in gangs and drugs and violence. We know that when kids are struggling with their mental health, they're more likely to get involved in gangs, drugs, and violence. So we need to do more to help our kids get the mental health services they need. That's why the Mental Health Improvement Act is such an important step in the right direction. This legislation will invest in community-based mental health services and expand access to mental health care for children and adolescents. The need for these services has never been greater. As a physician, I've seen firsthand the impact of untreated mental health conditions. When someone is suffering from a mental health condition, it can be incredibly painful and isolating. But with the right support and treatment, they can get better and live a fulfilling life. But we have to act early because when left untreated, mental health conditions can worsen over time and lead to dangerous behaviors. In fact, we know that young people who have high levels of emotional distress, who are involved with drugs or alcohol or tobacco, who have learning disorders, and who hold antisocial beliefs and attitudes are all at increased risk for violence. The good news is that we have a proven strategy to address this problem: increasing the behavioral and mental health workforce. When we increase the number of mental health professionals, we create more opportunities for early intervention and violence prevention. And that's exactly what the Mental Health Improvement Act will do. This legislation will fund training for 10,000 mental health practitioners. That means more counselors, psychologists, social workers, and psychiatrists who can help kids in our communities. And it couldn't come at a better time. In the last decade, we've made some progress reducing youth violence. But as rates of depression and suicide have increased, we need to do more. In fact, suicide is now the second leading cause of death among young people between the ages of 10 and 34. And a majority of those who die by suicide have a mental health condition. We can and must do more to prevent these tragedies. And that's why I'm proud to support the Mental Health Improvement Act. This bipartisan bill is a common sense first step towards ensuring that our kids get the help they need to stay safe and healthy. As a physician, as a mom, and as a member of Congress, I'm committed to doing everything I can to protect our kids. And that's why I urge my colleagues on both sides of the aisle to support this important legislation. Thank you.